Hello, I'm Dr. Amatsu, a physician from Japan. When I began practicing medicine over 30 years ago in Tokyo, I quickly realized one thing. It's not the sudden or dramatic illnesses that wear people down the most. It's the chronic diseases, the silent ones, that slowly and steadily erode a patient's quality of life. Among them, diabetes is one of the most insidious, especially in the elderly. At that time, I didn't fully grasp how widespread this condition was. But the longer I worked, meeting more and more patients, not only in Japan, but also in major medical centers across the US, the clearer it became, type 2 diabetes is spreading fast. The numbers don't lie. 1 in 4 adults over the age of 65 has diabetes, and this trend shows no sign of slowing down. According to data from the American Diabetes Association, ADA, by 2023 there were around 37 million adults in the US living with diabetes. Of those, 90% to 95% had type 2 diabetes, the kind closely linked to lifestyle and the gradual decline of insulin function over time. More than half of these cases were in people aged 65 and older. What's more concerning is that about 7.3 million others were undiagnosed. They lived as if nothing was wrong until complications set in. Over the years, I've seen many elderly patients come in with what seemed like minor issues: a foot ulcer that wouldn't heal, sudden blurry vision, a tingling sensation in the feet, or a dull chest discomfort. Many never suspected diabetes, but after testing, results often showed the disease had been silently present for years. Diabetes is more than just high blood sugar. Many people think of diabetes simply as high blood sugar, but if you stop at that definition, you'll miss the true nature of the disease. Type 2 diabetes is a chronic metabolic disorder linked to an imbalance in insulin, the hormone that regulates blood sugar levels. When insulin becomes less effective or there isn't enough of it, glucose stays in the blood instead of entering cells to provide energy. Over time, this leads to high blood sugar and damage to various organs. Here are the general diagnostic thresholds. Fasting blood sugar, normal, 70-89 median DL, 3.9, 5.5 mmol, L. Prediabetes, 100 and 125 mmol on DL, 5.6 to 6.9 mol on L. Diabetes, group 1, 126 on DL, 7.4 mol on L, confirmed on 2 occasions. HbA1c, average blood sugar over 2 to 3 months. Normal, 5.7%, prediabetes, Sancho 7, 6.4%, diabetes, just 6.5%. If blood sugar remains uncontrolled, it damages the small blood vessels in the body. Eyes, diabetic retinopathy can cause blindness. Kidneys, risk of chronic kidney failure and dialysis. Nerves, loss of sensation, foot ulcers, higher risk of amputation. Major arteries, increased risk of stroke and heart attack. Aging and diabetes, how the body changes. As we age, our bodies process food, especially carbohydrates, differently. In younger individuals, insulin works more efficiently, but as we grow older, the body becomes less responsive to insulin. This is known as insulin resistance. The pancreas then works harder to produce more insulin to keep blood sugar levels stable. However, the pancreas can only compensate for so long. Once it becomes overworked or begins to weaken, blood sugar starts to rise. That's when prediabetes begins. And if nothing changes, it progresses to type 2 diabetes. Some statistics show the scale of the problem. About 25% of adults over 65 in the US have type 2 diabetes. Obese individuals have 3 times the risk. People who are physically inactive have 2 times the risk compared to those who stay active. Other factors that make things worse include high blood pressure, abnormal blood lipids, loss of muscle mass, increased belly fat, poor or disrupted sleep patterns, lifestyle and diabetes, hidden habits that increase risk. In older adults, lifestyle plays a major role in diabetes risk. Sedentary behavior, poor diet, and social isolation all increase the likelihood of developing the disease. Here are some common habits that raise blood sugar. Eating too many refined carbs, white bread, instant noodles, white rice, regular consumption of fried food and fast food, not eating enough vegetables, fruits, and whole grains, poor sleep habits, staying up late, minimal or no physical activity daily. According to the CDC, an unhealthy diet can increase the risk of developing type 2 diabetes by up to 40%. Chronic stress is another factor that shouldn't be overlooked. When you're stressed, your body releases more cortisol, a hormone that raises blood sugar. A real-life example, John, 68, lives alone in New York after retirement. He regularly eats frozen pizza, drinks soda, and spends hours watching TV. After experiencing fatigue and unexplained weight loss, he went to the doctor and was diagnosed with type 2 diabetes. Early warning signs, don't ignore them. In older adults, diabetes often develops quietly, with subtle symptoms that are easy to dismiss. Look out for persistent fatigue even without much activity, excessive thirst, frequent urination, especially at night, slow healing wounds, itchy skin, especially in the genital area, unexplained weight loss, so blurry vision or flashes of light in vision, numbness or tingling in hands and feet. In U.S. surveys, over 30% of people with diabetes didn't know they had it. By the time they were diagnosed, the disease had already affected their eyes, kidneys, or heart. Important tests you should know, see the chart below. To diagnose or monitor diabetes, there are a few key tests you should have done regularly. The chart outlines the main tests. Fasting blood sugar, HbA1c, or post-meal blood sugar. Depending on your levels, your doctor can determine whether you're at risk, pre-diabetic, or diabetic. In addition, older adults with diabetes should also check kidney function, serum creatinine, urine microalbumin, blood lipids, total cholesterol, LDL, HDL, triglycerides, heart function, regular ECGs, liver, eye, and peripheral nerve health. After more than 30 years in medicine, I believe the most important approach to diabetes, especially in the elderly, is not just treating symptoms after the disease worsens, but recognizing and preventing it early. Type 2 diabetes isn't a death sentence, but it must be taken seriously. It's a long journey that requires you to understand your body, pay attention to subtle signs, and slowly change your lifestyle, one day at a time. If you're over 60 or have loved ones in that age group, don't hesitate to schedule regular blood sugar tests. A simple test today could help you avoid serious complications down the road. Start small, eat better, walk more, sleep enough, and keep your mind at ease. Good health in old age isn't just luck. It's the result of awareness and proactive choices. I'm Dr. Amatsu, and I hope what I've shared today helps you live a healthier, more independent, and happier life in your later years. Because aging doesn't have to be a burden, it can be a meaningful, fulfilling chapter if we know how to care for ourselves.